Welcome to BevCap Health Benefit Program Overview. Today's presentation covers the key components to help you maximize your benefits inside the BevCap program. Your specific plan design and coverage will be on the next video. It's a simple process. Only need to remember three things. The first one, free. We're going to talk about a lot of free benefits that we're excited to share with you as you are welcomed into the BevCap program. The second thing is the member advocate. This member advocate is going to be able to assist you with any questions and guide you through the complicated healthcare maze. And third, BevCapHealth.com. So all of the tools and resources are at your fingertips. So let's dive right in and talk about these free services. We're going to have Call a Doc 24/7, 365 days a year. You're going to have a doctor at your disposal for any needs that you may have. Surgery centers. You obviously have your local hospital and local surgery centers. But BevCap offers 15 surgery centers across the country where there's no copay, no deductible, no coinsurance. 100% free after utilizing the member advocate. U.S. Imaging Network. If you need an MRI, a CAT scan, PET scan, we have 2,200 facilities across the country that provide free imaging. And last but not least is care management. We're going to provide skilled nurses that are here to help guide you through the healthcare maze. So what does this free benefits look like? You're going to have a normal insurance card, but we're also going to provide you with a card that looks just like this. Your HR department will have plenty of these on hand. We have them both in English and Spanish, but as you can see right in the middle, the member advocate, the number and the email will help care all of your questions. So the first thing that's free is obviously your preventative care. We want you to go get your annual physical each year. Make sure you're going into your doctor, preferably the in-network to keep it free, but your annual physical is 100% free. Ask those questions, take good notes, but make sure you go and get your annual physical. Second benefit is the Call a Doc, 24/7, 365 days a year. As you can see from the screen, this is just a portion of the coverages and conditions, but this is about 25 of the most common occurrences. You don't have to take off a half a day at work. You don't have to pay a copay. Simply from the comfort of your home, pick up the phone, call the doctor. The doctor will understand and treat your symptoms and give you a prescription if that's necessary. If you're more that would like to go online, you can obviously email them, or if you want to Skype or FaceTime, they have that access as well. How does it work? Simply pick up the phone, give them a call. Time off of work is reduced, time away from the family is reduced, but most importantly, there's no copay. And this is good as long as you, the employer, are covered under the plan, your spouse and children, even if they're not covered under your health plan, but are still living at home with you, they're all covered under the 24/7 Call a Doc. So what happens if you need one of those major procedures like a surgery? If you call the member advocate, as we said, we have 15 surgery centers across the country. The member advocate will work with you and your providers to make sure that your surgery can be done at one of those 15 centers. And if so, there's no deductible, no coinsurance. The plan pays 100% of your travel costs. If it's local, we'll pick you up in a limo type service. If you need to fly, both the airfare for you and a significant other are covered. Once you get there, you arrive in the hotel. There's a gift basket waiting for you in the hotel room. We give you a per diem to cover all incidentals like meals and things that go while you're out of town. Once you go to the surgery center, no deductible, no coinsurance, 100% free. Transportation back home, and when you get home, there'll be a goodie basket or a bouquet of flowers saying get well soon. So we hope you don't have to have surgery, but if you do, remember, call the member advocate and you can have that surgery for free. Average surgeries today are costing you, the employee, about $5,000 out of pocket after your deductible and co-insurance. So you have a choice. Do you want to spend your $5,000 or do you want to have it free? If so, pick up the phone, call the member advocate, and this is how it works. They will simply take care of everything for you, coordinating all of the medical records from your providers and also coordinating all the travel and hotel accommodations. Imaging. If you need to have an MRI, a CAT scan, PET scan, a high-end imaging, we have 2,200 facilities that you can utilize through the U.S. Imaging Network program. And if you go, it's a zero copay, 100% free. If anybody has had one of those, you know that they can range anywhere from $500 to as much as $3,500 for the exact same imaging. At U.S. Imaging Network, it's 100% free. So we've talked a lot about the member advocate. We want to highlight it one more. There's the email address, their phone number. All you have to do is hit option 3. They're there to help answer any questions. You may have an explanation of benefits. That's that bill that you get once you've gone to a doctor or facility that comes in the mail. And no one ever knows what those numbers really mean. Call the member advocate and they'll walk you through it. If you have questions about a claim or a billing, they're there to help that. If you need to find out if your doctor is in network or out of network, call the member advocate and they can assist. If you want the member advocate to help even schedule that appointment for you, the nurse advocate can do that. Here's a copy of what a sample ID card would look at. Obviously, your employer's logo will be on the front with your name and information. Boone Chapman, Aetna, because that's the network of providers that we're using. The Colodocs on the back, the member advocate, all of your benefit needs are there. So you'll be receiving this in the mail prior to your effective date. If you have any questions, if you lose that ID card or need to get a new one, or you need to add or change, or just questions, remember that member advocate, the free benefit card, have every question that you need, we'll have the answers. Other services that Boone Chapman are providing for you and your family: case management and disease management. We realize that healthcare is complicated and a lot to take in. In this short video, we're not trying to make you experts. We want to inform you of the new enhanced benefits that are now available to you, but let them be the expert. Call that member advocate. If there's a case management, if you're having conditions that you need to talk through with somebody, the nurse will be there on the other end of the line. But let's say that you're one of those, maybe a chronic condition like asthma, hypertension, diabetes, high blood pressure, and you have questions or concerns, or just wanting someone to help walk you through the maze of what these conditions are and what are some of the tools and resources. Let that disease management nurse be of assistance. And what does that look like? It's a dedicated nurse. So you're getting to talk to the same person every time you call in versus having to explain your situation time and time again. It is that dedicated nurse that's here to help you navigate through the maze. If you have questions about family members, about their healthcare needs, you just want additional education or some questions, if they need to help you with billing and claims, understanding the overall benefits, make sure you let those nurses at Prime DX and Boone Chapman help you navigate this complicated maze. We've talked about Aetna as your network of providers. Aetna is the network. It's the largest network across the nation. But you don't have to know if your doctor's in network or not. Simply go to BevCapHealth.com, do a provider search, or better yet, pick up the phone, call Member Advocate, hit option 3, or you could simply just email the Member Advocate and ask if your doctor is in network. Envision RX. This is our pharmacy benefit manager. In simplest terms, basically you can go to any pharmacy that you've been going to get your drugs. We have over 72,000 facilities across the country. But if you have any questions, once again, call the Member Advocate and they'll be happy to assist you. So as we're being good consumers in this healthcare maze, what are some things that you can do to help manage the plan even better? Obviously, always call that member advocate, and they're going to give you the best and most cost-effective benefit. Using the Aetna network, make sure you're utilizing in-network providers versus out-of-network. More benefits to you, more benefits to the plan. Emergency room. Avoid the unnecessary visits. If it's life or limb threatening, absolutely go straight to the emergency room. But if you have the flu or an earache, go to the urgent care, or better yet, the call-a-doc that we talked about earlier. Use the 24/7 call-a-doc. But if it's life or limb threatening, go straight to the emergency room. Choose generic prescriptions when available. Use the pharmacies. A key component here. If a pharmacy sells food, i.e. a grocery store like a Walmart, instead of a freestanding pharmacy, you're going to get the most benefit for your buck because it's usually the lower cost of the pharmacies. If you're on maintenance medication, try to get a 90-day prescription. It's going to save you money, save the plan money. We've talked enough about urgent care versus emergency room, but there's a plethora of urgent care. I will tell you to be careful because a lot of the new clinics look like urgent care, but they still charge emergency room prices. So don't be afraid to, when you walk into that urgent care, and go, is this an urgent care or is this a freestanding emergency room? And then last but not least, call a doc instead of that urgent care or emergency room. And even instead of a primary care doctor, the convenience of being able to take it from your house, work, while you're driving down the road, pick up the phone, call the doctor, get that prescription sent straight to your pharmacy without ever leaving your house. And better yet, there's no copay. It's 100%